I think we're good to start. Excellent. Thank you everyone for joining today's the University of Adelaide Faculty of Health and Medical Sciences webinar, along with the international recruitment team. So we have all the regional managers along with Eng and also Sherry, who assist us in recruiting future students, and our not guests, but the main focus today is on the Faculty of Health and Medical Sciences, and the webinar will be led by Ms. Nicole Rubino. Few points before we head start. I request all the participants, if you have any questions during the webinar, please feel free to put all your questions under the Q&A section. So we can track all the questions and answer at the end of the webinar. So usually Nicole's presentation would take about 30 to 40 minutes, and we will keep about 20 to 30 minutes at the end to answer all your questions. Nicole, over to you, please.
Thank you, Vivek. Hi, everyone. It's great to have you all join us today. So as Vivek mentioned, I'm from the Faculty of Health and Medical Sciences, and today I'm going to be talking to you about medicine, dental surgery, nursing, our new allied health suite, psychology, and our postgraduate public health as well. So that'll be the main focus of today's presentation. I did have some videos that I wanted to play you, but it looks like we're having trouble with those. So I'll get Vivek to send the links around to you afterwards and you can see them as well. So we'll skip over that part, which will make it a little bit shorter in time anyway. Okay, so the Faculty of Health and Medical Sciences is ranked #1 in South Australia for life sciences, medicine, nursing, psychology and dentistry, along with #1 in Australia for our health and medical sciences general research. And Lord Howard Florey and Dr. J. Robin Warren are among our most notable alumni, so we're very proud of that fact. So I wanted to share with you some of our undergraduate degree rankings, and as you can see from these rankings, that studying within the Faculty of Health and Medical Sciences means that the students are getting a world-class education ranked really highly in the state, in Australia and the world. So I'd like to share with you some of our facilities that the students would be utilising throughout their study in health. And this is something that I really encourage you as our partners to be able to feel really comfortable to promote, because it certainly sets us apart from a lot of the other universities. And we're really proud of these facilities and hope that all of our students find them as exciting as we do. So the Adelaide Health Simulation is the most technologically advanced simulation facility in Australasia, and it's the only Australian simulation facility which is accredited with the Society for Simulation in Healthcare. And it was designed to accommodate the needs of the university undergraduate medical, nursing and other health sciences students, and our new allied health students next year will use these facilities as well. The Dental Sim Clinic was opened in early 2013, and this is where the students acquire and develop their clinical skills through our dental surgery and oral health degrees. The clinic has 90 individual simulators, each have their own mannequin dental equipment, PC and monitor, as you can see in the picture in the corner there. So the Ray Last laboratories, which are located within the Adelaide Medical School in the Health and Medical Sciences building there, encompasses both surgical skills and anatomy areas. And these are being designed to service a wide range of uses through our undergraduate and postgraduate teaching in anatomy, and advanced surgical training, simulation, clinical skills and research. A lot of outside companies that are training doctors actually use these facilities as well because of the state-of-the-art equipment there. They're able to actually train a lot of doctors from all over the world, which is really exciting. So linked to the Adelaide Medical School and the Ray Last laboratories is the body donation program. And the Adelaide Medical School operates a central mortuary facility on behalf of the universities within South Australia, and they accept all bodies donated to science. This is a really important opportunity for our students to be able to dissect the human body, and it's a real privilege which is not available in many parts of the world. And our students, although it's a little bit scary to start with and a bit overwhelming, they actually really consider this a really valuable part of their learning. So certainly something to promote to future students, looking at the way we actually teach the degrees and the opportunities they have throughout them. Hoping that most of you have seen, if not in person, but in digital form, the Adelaide Health and Medical Sciences building, or better known as AHMS. And this is our flagship teaching and research facility, home to the medical school, the dental school, our nursing school, School of Public Health and our Robinson Research Institute. And importantly, it's located next to the Royal Adelaide Hospital and the South Australian Medical Research Institute as well. Okay, so this is really important for our clinical degrees, the Adelaide Health Simulation. It actually reflects a clinical environment where students are required to assess and troubleshoot, propose actions and perform the correct treatment and procedures on a patient. And these scenarios include the use of the high-tech mannequins that you can see on the tray there. I shouldn't call it tray, but tray for want of a better term. Also, we employ actors that we call standardised patients. So they play the role of a patient or a relative to help assist in the students' learning. So it really helps them learn how to treat and deal with patients when they're diagnosing them. And importantly, they have the opportunity to make errors without causing harm, and then to observe the outcomes of those different actions. So the hospital suites within the Adelaide Health Simulation actually mirror the single patient rooms in the Royal Adelaide Hospital. So the facilities are really familiar to the students, which actually helps them feel really comfortable when they do go on to placement in those settings. This is a video that won't play, so I'm going to skip that because I can hear it, but I don't think the rest of you can. So that's not quite the idea. So let's move on to dental surgery now. So we often get asked, what do dentists do? And it's really important to understand what a dentist does. And I think importantly for the students as well, because sometimes they have this sort of idea about what being a doctor or a dentist is from what they see on TV, but they really need to understand exactly what that career is for them and understand sort of what they're signing up for essentially. So dentists really specialise in oral health, and their responsibilities include such things as diagnosing oral diseases, promoting oral health and disease prevention, creating treatment plans to maintain or restore the oral health of their patients. They interpret x-rays and diagnostic tests, and they also ensure the safe administration of anaesthetics as well, among a lot of other things. So dentists really are the clinical team. They sort of oversee everything. Think of them as the team leader for that oral health team. Okay, so our Bachelor of Dental Surgery degree is the only professional dental degree in South Australia. The important part early from first year is that clinical experience in those simulation facilities that I just showed you. And they'll start to explore a full range of dental therapies. So starting out from the really basic and then building up to the more complex treatments as well. They will tackle real life scenarios in teams. So problem solving and skills like good communication are really important. They will essentially be looking at sort of cracking those cases of real life scenarios. So a reminder that it's a 5-year degree. The minimum international ATAR we're looking for is 90 or 34 for IB, and there is an IELTS requirement of level 7, which is 7 in all bands and 7 overall from the 1 test sitting. There are some prerequisite subjects there as well, which the students need to do either through their through their high school studies, or if they're coming in through other areas such as health and medical sciences, they could do those through there as well. We have 36 international places in the Bachelor of Dental Surgery, and I wanted now just to show you a brief rundown about the different years and looking at some of the career options. So you can see there that they're starting with the initial phases of patient care. They'll then start to build on that in year 2, so starting to develop some scientific skills about examining and assessing and managing minor conditions, and that builds over the next few years to start looking at more complex dental disorders as well. Year 5 is really consolidated as the clinical placements year, so that's when the students are actually in those clinics. And luckily at the top of the Adelaide Health and Medical Sciences building is our public dental hospital for South Australia. So the students actually do a lot of their clinical work in that facility, but not only in that facility, they work in a range of community areas as well, but really lucky to be able to have that available. It's literally straight up the road, so it's fantastic. As you can see there, there's a range of career options that the students can work in as well, from private through to public sector too. So as I mentioned, there's 36 international fee-paying places for 2020. There's the prerequisite subjects and the academic score, along with the English language requirements as well. So part of the process is that the students actually register for the UCAT ANZ, and hopefully by now you've been made aware that the registration date for the UCAT was extended. It actually closes today. So if you do have any students who are in the process of applying or still unsure about applying, they must apply for the UCAT today. Otherwise their application wouldn't be considered for 2021 entry. So really important that they do that quickly. After the UCAT ANZ, we advise approximately 170 students will be eligible for an interview, and they will happen in late September, early October. Usually we have the option of face-to-face interviews and interviews via video conferencing. With the borders closed this year, we assume we're not really sure what that will look like yet, but we'll make sure that we update our admissions guides and let your regional managers know as well, so that they can pass on that information. It will certainly be based on what the government regulations are. So watch this space for any changes to the interview process. As I mentioned, we have 2 comprehensive admissions guides, one for domestic applicants and one for international applicants. So if you do have any domestic applicants that are sort of offshore, we don't expect you necessarily to know all the information, but certainly point them in the direction of the guide, and then they can get all the information that's relevant to them. Okay, so let's look at our medicine degree. The medicine degree really aims to teach from day one skills such as critical problem solving, teamwork, and integrity, and that really underpins our medicine degree. So I wanted to share with you some of our graduate satisfaction and employment results through the medicine degree, and as you can see there, the employment rate is actually above the national average. And importantly, that final year of the program, which I'll explain in a little bit more detail at the moment, it's revealed that the University of Adelaide's #1 in Australia for preparing our medical graduates for practice with clinical experience. And it means that our graduates are feeling really comfortable to transition into their role as junior doctors once they graduate from the university. Okay, so just a reminder that our clinical simulation happens from first year. We're beginning to teach them how to be a doctor from year 1, from day 1, essentially. So the students will have a range of clinical simulation experiences from first year. They'll gain that really practical hands-on theory, which works in well with the theory and then the practice, so they'll get that opportunity. And throughout the degree, they'll undertake extensive clinical placements in hospitals and other medical organisations as well. So our 6th year is what we call our pre-internship year. So the students don't get paid for that year. It's the final year of their degree, but it's an important part of preparing them for internship for the year after they graduate. Reminder of the requirements there. There's the 1 intake, international ATAR of 90 or above, and an IELTS of 7. So in years 1 to 2, the students are introduced to those clinical scenarios, which really provide the basis for learning about the scientific sort of foundations of medicine. So they'll work in small groups, often with the surrogate patients that we talked about earlier, and they'll assist the students to really enhance their clinical and professional skills as well. We do have some very specific courses just for medicine, which really highlight the students learning how to be a professional straight away. In year 3, the clinical skills training is conducted primarily in the teaching hospitals, and then the students go out onto their placements in years 4 to 6 into the community settings as well. So in years 4 to 6, there's an elective program which really allows the students to explore specific areas of interest. So throughout the clinical placements, we get them to experience a whole range of different areas, and we really ask that they keep their minds open, because sometimes they come in quite focused that they want to be a specific clinician, like a pediatrician, and they go on their first rotation in pediatrics and think, oh, that's not what I thought. So we really encourage them to keep their sort of options open and to really try everything that they can and get the most out of it, because there just might be something there that they hadn't thought of before. So there are some rural placements as well, which happen in year 5. Some students elect to stay for the whole year and others will do a 9-week placement, but a rotation in a rural setting is a compulsory part of the program. So the major exams conducted in year 5, and then year 6, they focus on their clinical practice and professional development. So I just wanted to make a note, we often get asked about internships, and they're quite separate from the medical degree. So the university doesn't facilitate internship placements, but if you have any students that are wondering about the internships, then you can have a look at the South Australian Health Careers website, so the Department of Health website, and there's a lot of information there about the internships, but we'll help them along the way to understand what the process is once they finish. Okay, so just briefly, as I mentioned, they undertake the clinical placements in years 4 to 6. In year 4, they will do what we call a surgical home unit placement, which is a 9-unit placement concentrating on the discipline of surgery. In year 5 is the placement where the students will live and work in a rural or regional community as part of the program. And then year 6 is the selective program. So they must complete at least 4 weeks of placement in a rural location. And then in the 6th year, it offers them some elective placements in community locations as well. So we do have a clinical placements team that assist with all of the clinical placement requirements. So the students don't have to self-source anything. So important to note that that's all done for them. Okay, so we'll just briefly mention the application process as well. So there's the prerequisite subjects we've mentioned, the academic score of 90 or above, the English language of 7, and then the UCAT registration as well. So reminder that medicine also requires the UCAT, which actually closes today. They have extended the UCAT registration. So important that they do that tonight. So the interview eligibility is based on their performance in the UCAT, and we'll be inviting approximately 160 international applicants to attend an interview in late September, early October. And then after that, from October onwards is when we make our offers to the successful applicants. And we have 34 international places for 2021. And there's our comprehensive admissions guides as well, which you can find online, but we can provide you with links to that as well. Okay, so I just want to talk a little bit about nursing now, and I just want to remind you that we do have a couple of different options, and this is the Bachelor of Nursing degree, and it's for those without an undergraduate degree. So if you are working with any students who already have an undergraduate qualification in a degree other than nursing, then they can apply for the Master of Clinical Nursing. But for the majority of students coming straight from high school, they will be applying for the Bachelor of Nursing. Okay, so the Bachelor of Nursing is a 3-year degree. It has 1 intake in February and an IELTS score of 7. So important to note, it's 7 in all bands and 7 overall. The minimum international academic score is 70, and that's an IB score of 25. So there's no prerequisite subjects, but students often find biology is quite useful to have studied throughout high school. We certainly teach it throughout the degree, but if they have a bit of a background, it does make it a little bit easier for them. So again, we will teach the students to develop their hands-on skills in the simulation facilities that we showed you earlier. But importantly, they'll undertake interprofessional learning with other health disciplines as well, because we're really aiming for the healthcare to be a team. And so we start that process really early so that they learn how to work with others within a healthcare setting. We have approximately 60 international places for students in the Bachelor of Nursing. So we've got lots of space and lots of places for them. Okay, so that early clinical exposure with placements happens from semester 1. So very early in the program, the students are involved in the clinical settings, but also in wider areas as well. There is a compulsory rural placement in 2nd year. But just note there that we have over 1,000 hours of compulsory clinical placements, and that's more than we're mandated to teach, but it's actually what we're really well known for, that our students are really clinically competent by the time that they go out into the community. And I think that's a really important, not only do we feel like we're teaching them that, but they're feeling confidence within themselves. So really important that we have as much clinical placement as we can. So those clinical placements happen in metropolitan and rural areas as well. And you can see some career options listed there as well. Okay, so I just wanted to highlight a few of these areas that the students need in preparing for their study. So I just wanted to let you know that these don't need to be supplied at the point of application, but before they will start in their clinical placement. So the things to note are that the international students are required to obtain a criminal history clearance from their home country and bring that with them when they arrive in Australia. They also need to bring their childhood immunisation records as well, so we need them to bring those with them. All of the other checks there, we'll actually teach them about those and let them know what that process is through our clinical placements team that I mentioned earlier. So they don't need to do all of those things before they get here, apart from the couple of things that I mentioned there. So we'll make an appointment for them through our clinical placements team with the doctors on campus, and they will get the rest of those checks done. Okay. Okay, so clinical placements, as I mentioned, are compulsory. They're a really important part of the process for the students and a really critical part of their learning. Important to note that they may be across a 24-hour, 7-day-a-week schedule. So we really want the students to actually experience nursing as they would out in the community. So there may be early morning shifts, late shifts, weekend shifts, public holidays. And the placement blocks happen across those 3 years of the program. The placement areas include a wide range of areas such as emergency, palliative care, aged care, perioperative nursing. And again, we want the students to keep their minds open so that they really try and experience something that they may not have thought of before. So clinical placements, all of the costs that are associated with the clinical placement, and particularly the rural one, are the students' responsibility. So we usually say to them, you know, it's around about $1,000 to cover all of their accommodation and food and living away from home expenses. So we just like students to be aware of that. So that they're not surprised up front. And of course, they do need to wear their uniforms, as you can see in the picture there. So those sorts of things need to be purchased before they go on their clinical placements. Okay, the students will actually be notified of their allocation about 6 weeks prior to going. So they've got plenty of time to get things organised. An important part of the experience for students is going on a global study tour, and for nursing specifically, we have them in the locations listed there on screen. So Japan, Austria, Singapore, Germany and Canada. And the students get to experience nursing from a different perspective rather than just what we see in Australia. And I think, you know, it's very important that they experience that from a whole range of different areas. So certainly, it's not compulsory, but certainly going on those study tours, it's a really good option for the students. Okay, so I'm going to move on to our psychology offerings. I'm going to concentrate on the Bachelor of Psychological Science, but then also show you a little bit of information about how the students can become a clinical psychologist if they want to. I'm going to skip past that video. Okay, so our Bachelor of Psychological Science is a 3-year degree, and we do have 2 intakes for that. So one in February and one in July. So if you have any students that are considering, they are able to apply for that July date as well. And the IELTS is a 6.5. The minimum international academic score is a 75 or an IB of 27. So the really great thing about the Bachelor of Psychological Science is its flexibility. So the students really learn some really core topics, but they also have the option of choosing from over 35 different majors. So my degree might look different from yours, and that's totally fine. It'll be based on what your interests are as well. I won't go too much into in terms of the courses, but just note that there are some core courses, as I mentioned, and then some elective courses that the students can choose. And we have a team within our student support team, which will actually help to build a study plan that's really specific for each student. So they don't need to decide straight away what they want to do. We can certainly help them decide as they go along. So as I mentioned, we have over 35 different options for majors, and there's just a few of them on screen. So you might find that there's someone that's interested in psychology and also criminology, and we'll be able to package all of those things together for them to make a really unique degree for them. So our Bachelor of Psychological Science really allows the students to have exposure in a range of different areas, including mental health, intelligence, personality, cross-cultural psychology. It will give them experience in the basic testing that's done through psychological testing. So they start to build on that as they go throughout the years as well. So that's just a few areas that the students will be exposed to. We often get asked how a student can become a registered psychologist, and there's a few ways, and at the University of Adelaide we've got sort of all options for them. So they could either do the Bachelor of Psychological Science that I just mentioned, and then a one-year honours, and then they could look at a Master of Psychology, and we offer 3 different areas, and I'll talk about those in a minute. The other option is to do a Bachelor of Psychology Advanced Honours, which already includes that honours year. So that's another option as well. Slightly higher entrance scores and things like that, but essentially either of those will get you to the same place. And we had some graduate entry pathways as well. So the masters that we offer in clinical psychology, in psychology health, and also organisational and human factors as well. And there's some descriptions there about what each one actually means. But a traditional psychologist, they would need to study the Master of Psychology Clinical. Interestingly, the other areas of psychology are becoming really popular too. So I think, you know, we're realizing that psychology is not just pigeonholed into that clinical area. There's a lot of different organizations that are using, particularly the organizational and human factors in terms of looking at marketing and consumer behavior, in looking at businesses and recruitment. So there's lots of different areas that students can go into. Okay, so as hopefully you're aware that from 2021, we are going to be offering a suite of allied health programs, and I'm just going to run through them with you now. So I wanted to let you know that, you know, sometimes we get asked again, what is physiotherapy? We may have been to a physiotherapist for a specific issue, but we don't necessarily know what they do in total. But physio is really concerned with helping people recover, maintain and enhance their ability to move freely and without pain. So physios employ things like physical examination, diagnosis, intervention, rehabilitation and education. And physios really help people of all ages, so not just one specific age range. They help them to preserve physical condition during and after illness and also improve athletic performance as well. So we're really excited that we have a Bachelor of Physiotherapy Honours starting next year. And very much like medicine, the entry requirements are similar. So the 1 intake, an IELTS of 7, minimum international academic score of 90. There's no interview and no UCAT for our Bachelor of Physiotherapy. It's purely based on those entry requirements that you can see on screen there. We are really excited to be building some brand new facilities for all of our allied health areas. I don't know what they look like yet, so I'm super excited to see them myself, but we will be having things such as rehabilitation gyms, and that's for physio. We will have things like musculoskeletal spaces, we will have acoustic spaces. So I'm really excited to see when they're built, and they will be ready for 2021. So I'm sure that as soon as we're able to, we'll make sure that we get that information to you as well. So just a brief introduction about what's involved over the 3 years. So the students will start to be introduced to anatomy and physiology, looking at focusing on what the principles of physiotherapy and body movement and how to actually be a professional as well. Year 2 will build on that, and they'll start to look a little bit more specifically at things like the biomechanics of the human body, and also looking at physiotherapy management. The final 2 years of the program, they will start to narrow down some specialised practice principles and look at things like gender and age-specific needs, but also managing clients with some quite I guess, dysfunction within their body. So starting to look at, you know, neurological dysfunction and areas like that. And then clinical placement courses, of course, throughout the degree as well, and they will build on the simulation and then out into clinical practice too. So in 2021, the initial intake for this program will be approximately 57 students, and that will include both international and domestic. And I'm very pleased to say we already have some applications for this program in 2021 from international students, so that's really exciting. We're currently working with the Australian Physiotherapy Council to achieve the accreditation for this program. And then once it's accredited, the students will be able to register as a physiotherapist. I can tell you that the accreditation is going well. Stage 1 is complete and it's all on track. So we're very excited about that. One thing to note is from third year that the students will be able to choose one of two streams, either the research stream or the industry stream, and they'll undertake a major project in that area. So the research stream will hone their skills in developing new knowledge, and the industry will focus on integrating research into practice. Likewise, we'll be offering a Bachelor of Occupational Therapy, and occupational therapy uses intervention and assessment to enable people to actively and independently participate in activities that they find meaningful, such as, going to work, socializing, looking after themselves, those things that we sometimes take for granted. So our occupational therapists really help people to live their best life to the best of their ability. The same entry requirements as the Bachelor of Physiotherapy, and essentially they will be learning a little bit about rehabilitation, I guess, and that's where the rehabilitation facilities will come in. They'll also start to explore things like cultural diversity, and we will be focusing quite heavily on our Aboriginal and Torres Strait Islander people and communities, as well as rural and international perspectives as well in our occupational therapy degree. So the students will start to build on the occupational therapy principles. They will, in year 2, build on looking at more of the anatomy of the lower and upper limbs and looking at the pathophysiological basis of diseases. So what can go wrong with the human body that's going to affect people living their best life? So we'll be starting to focus on those areas in year 2. Then again, they'll start to be looking at areas such as children and families and neurological conditions, mental health across the whole lifespan. So how does that actually affect people living their best life? Throughout the degree, we will be having the students supervised by registered clinical professionals. Some of them are already on board with us and some of them we're yet to employ, but it's moving forward very rapidly, so we're really excited. So for this degree, we will have approximately 35 students across both international and domestic cohorts. And again, we're currently working with the Occupational Therapy Council of Australia to achieve the accreditation. Stage 1 is complete and all is on track. So we're not anticipating any issues with that accreditation. The research and industry stream that I mentioned earlier also is for the Bachelor of Occupational Therapy as well, but the students don't need to decide on that early on. We'll work with them throughout that. Okay, and the last one in speech pathology that I wanted to mention was, in allied health that I wanted to mention was our speech pathology area. So that really involves working with children and adults of all ages to overcome physical and developmental challenges to communication and swallowing. Speech pathologists really use their knowledge and skill in anatomy and linguistics and patient-centered care to diagnose and treat a range of speech and language problems. Same admissions requirements, no UCAT, no interview, and you can see there that this is more focused around the head and the neck anatomy and neurophysiology. It's very focused on communication development, linguistics and word formation. So it's quite a niche market. It's quite specialised in that particular area. And you can see then again, I think you'll start to see a pattern where the first year builds on the next and starts to look at developing their knowledge in communication development, linguistics and psychology, which is important for mental health for clients as well. Okay, so for this program, we will initially have only 25 students across international and domestic markets, but that will grow in the next few years. So I'm happy to say that we will be having more places, but we're keeping it quite small to start with. And we're working with the Speech Pathology Australia to achieve that accreditation for that degree. The research and industry stream is also relevant to this particular degree as well. So I just wanted to run you through some of the technologies that the allied health students will utilise at the University of Adelaide, because I feel that it's all very important to know what the admissions requirements are, but what is it that the students will actually be doing, I think is really important. So they'll have access to the Health and Medical Sciences building and the Adelaide Health Simulation, as I mentioned earlier, to support their learning. That's where they'll do some of their preclinical simulated placements, but they'll also do their observed structured clinical exams there as well. So we call them OSCEs. The anatomy teaching will happen in the Ray Last laboratories and the Vernon Roberts Museum, as we talked about earlier, but the students will have access to such technology as sector tables and other specialised equipment. So a sector table is like a large interactive screen, and it facilitates interaction with 3D images of the human body. And so the students are able to zoom in, rotate or cut into the subject. And that means that they can study the various impacts of diseases in a real 3D image. So they're absolutely fantastic to work with. So as I mentioned, we'll be building discipline-specific teaching spaces, and they'll be ready for the start of teaching in 2021. So rehabilitation gyms, mock hospital wards, paediatric spaces, bedside clinical spaces, and for our speech pathology students, acoustic spaces as well. The students will also be encouraged to learn in and engage with things like telehealth, so the use of telecommunication techniques for the purposes of providing telemedicine to their clients, medical education and health education over a distance, so that they're able to reach a really broad spectrum of patients, not those that just are in the same area as them. So we're very excited about those facilities, and even more excited about the career opportunities. So we're predicting quite a big growth by 2024 in these particular areas. So that's the prediction, and we're very excited that we'll be able to offer this to international students as well. So a lot of the areas will be in both private and public areas, disability, rehabilitation centres, women's health and paediatric services, looking at kindergartens, primary schools, high school settings, mental health services, ambulatory services, and some may even go into academia and research as well. So really such a broad range of areas that they can go into, but I'm really excited to see that there's a good predicted growth there. Okay, so the last one I wanted to focus on was our Master of Public Health before we open it up for questions. So our Master of Public Health will actually help students develop an understanding of the global public health challenges, and it's quite topical at the moment with obviously everything that we're going through. So yeah, really they're going to learn strategies and practical techniques to really take action on these challenges. So it's looking at preventing disease and promoting conditions that optimise population health, essentially. So students then enroll in this program for a couple of different reasons. One is to progress their current role, or to obtain senior positions within health. So the Master of Public Health is suitable for both clinical and non-clinical health professionals. So we sometimes find that students have completed a bachelor degree and then want a completely different change of pace. They want a completely different career option. So the Master of Public Health is also suitable for someone who's already got a degree in another discipline, but now they're really interested in enhancing, health in populations, essentially. So we have a couple of different specialisations, and we have detailed study plans on our website which show those in detail. But essentially, two specialisations. One is public health, and the other one is population oral health. So the public health specialisation helps students with a broad knowledge in core public health disciplines, so such things as epidemiology, biostatistics, social and behavioural health sciences, and global public health and health systems. So that's really focused on that particular area. It helps them to advocate for change and to really create complex problems such as what we're dealing with now, that's not only affecting their own population but really globally. The population oral health specialisation is a little bit more niche, and it's really to equip graduates with the knowledge and skills they need to think about dental systems, those things that affect families and communities, but it's more focused on the oral health. So whereas the public health one is more broad, this is really focusing on the oral health of specific populations. So it really intends to equip graduates for careers in the public oral health area. Okay, so we have approximately 8 international places in our Master of Public Health, but if we have a lot of interest, we're more than happy to take more students. So really the sky's the limit with that particular area. Okay, and the last thing I wanted to mention is that we have a virtual showcase of our undergraduate degrees coming up. If you haven't already received an invitation to this, you will, either via the university itself, so my team, or from your regional managers will also provide you with information as well. It's mainly for students. I mean, you'd be welcome to join as well, but essentially it's for any future students that you're working with to be able to showcase and show them a little bit more about the degrees at the University of Adelaide. They'll also have the opportunity to chat with our current students as well. And I think it's important to get their perspective about what it is that they like about their study, what they don't like, the things they find challenging. So I'd really encourage you to promote this event to any future students that you have so that they can get, you know, real life experience from our students. So, okay, over to you, Vivek. I think I've exhausted all of my slides. So.
Excellent. Thank you, Nicole. I think you covered everything in 40 minutes. I'm sure you would have practiced it many times.
I have.
Excellent. Good. We've got quite a number of questions. Hopefully, we would be able to cover them all in time. If we are not, we'll make sure when we get in touch with all of our partners along with the presentation and the webinar link, we would be able to answer some of the frequently asked questions in that email as well, if that helps everyone. So I will do my best to be a moderator. If you know, I would read out the questions to you if you're okay, and I'll get the regional managers along with as well if there are any specific regional questions involved. So, Nish, go ahead, please.
Some of the questions were about basic requirements, which I've already answered. There are currently 19 open questions that are still there, which specifically I think Nick will be able to answer.
Yep.
No problem. Thank you, Nish. The first question we have from Singapore, maybe I can get Eng for you to answer. The question is related to the English testing, which is the recognition of prior learning for English. Are you able to read the question, Eng?
Yeah. Hi, everyone. The question is, what non-testing form of evidence is acceptable for meeting the English prerequisites for MBBS, BDS, nursing, oral health, and what grades? So the first one is other Year 12 English language, e.g. GCE A-level, AS general paper, A-level knowledge and inquiry, international baccalaureate, English standard level / higher level. So in answer to the first part of the question, they're all acceptable as evidence instead of provision of an IELTS or TOEFL, with the exception, they have to achieve passing grades. So the only exception is the nursing suite of programs, because in 2019, the Nursing and Midwifery Board of Australia basically revised the requirement. So unfortunately, some of the pathways available to previous students are no longer viable. So basically, unless the students from, I'll provide you the 7 countries. So unless they've completed studies in Australia, New Zealand, United States, Canada, UK, Republic of Ireland, or South Africa, the previous studies won't meet the English requirements for entry into the nursing suite of programs. But for other programs, we can accept these as evidence of English, provided they achieve passing grades. So we don't, with the IB, we don't distinguish between standard or higher level. So standard, they have to achieve a grade of 4 out of 7 and higher, it's 3 out of 7. And in terms of prior tertiary studies, in progress or completed, for degree transfer students, basically they just need to provide evidence of the successful completion, again with the exception of the nursing suite of programs. And I might need further clarification with respect to Year 11 English. I'm not sure what that's in relation to.
No problem. Thank you, Eng. Just to maybe add on to what Eng said, I think different regions have different basic English requirements, and in our email we would be able to clarify on if the prior English requirements can be accepted direct for bachelors of dental surgery or medicine programs. Moving on to the second question, maybe for you, Nicole. Do we provide 2 years of bachelors of nursing if a student has completed a diploma of nursing in Australia?
Okay, so students who have completed a diploma in nursing may be eligible for our enrolled nurse pathway, but that would mean that they have to be registered as an enrolled nurse with the training, AHPRA, the registering body. So we do have an enrolled nurse pathway, but I'm not sure whether you're thinking of it as a bridging course. It's not a sort of bridging course. I'm aware that UniSA used to do one. They don't do it anymore. So it's not a traditional bridging course, but depending on what they've completed, they may be able to enter the enrolled nurse pathway, but only if they're eligible for registration as an enrolled nurse.
Great. I think it's a great segue to the next one, Nicole, for you again. The question is, for those who have a nursing qualification in their home country and want to register as a nurse in Australia, what programs would the students be advised to take? Can they take Bachelor's of Nursing program, or do we have a different program?
Okay, so we don't have a shorter program. So essentially the students who already have a nursing qualification from their home country, it would need to they would need to be eligible to register for a nurse in Australia through the Nurses Board. So that's the first thing they would need to do, is to see whether their qualifications actually register them as a nurse in Australia. If they don't, then they would need to take our Bachelor of Nursing, but it wouldn't be for a shorter period. So they would still need to complete the 3 years of the nursing degree. The reason for that is that it's a very integrated program, and it's very much dependent on the clinical placement hours. So everyone has to start from that particular time frame unless they're coming in under a different pathway. But she would need to register in Australia first. That would be the first step to see.
Thank you, Nicole. The next question, it may be related to semester 2 or trimester 3, 2020. And the question is, will we be offering programs online?
So it depends on the particular program. Obviously, for medicine and dentistry and areas like that, we don't have that mid-year intake anyway. But we can't teach medicine and dentistry online. It's very much hands-on and very practical based. So at the moment, some of our students who did start in that degree and went home did need to take some time off, and they'll be back next year when things are back to normal. But for some of the areas like, psychology and some of the other areas, we are at the moment doing a bit of a blended learning. So yes, some of them will be delivered online in some capacity. We're still waiting to see what semester 2 looks like for the university. So there will be some information on the COVID-19 website, which will be updated as things go along.
Thank you. Just to add on to what Nicole said, I'm not sure if everyone has received an information from the Director of International Recruitment, Michael Ost. In an email that went out last week, there was a link which mentions about what programs and subjects will be delivered online. If you could visit that link, I think that will give you a lot more clarity. Nicole, for you, the next question is, do we have any specific places for international students from our pathway providers, such as University of Adelaide College?
Yeah,
I
so
believe
the place, yeah,
the places
go on.
would be for our medicine or dentistry program.
Right. So the places that I mentioned earlier, like the number of places, is across all of our different entry pathways. So whether they're coming in from school or whether they're coming in from foundation, that's the total number of places that we have.
Thank you. For a student willing to apply for an international bachelor's degree, do they have to send for 3 years APAC validation before the Bachelor's of Honors Psychology 1 year? I think the
Yeah.
question is, can they start straight into the honors year?
So their qualification has to actually be registerable with the psychology board. So they would need to check that their qualifications match in order to be eligible for the honours degree and then eligible for the master's degree.
What are the English IELTS requirements for the international students if they are Australian school leavers? Maybe for you, Eng or Shirley, or Nicole, if you can answer.
Yeah.
I'm happy for Nicole to answer that if you want.
Yeah, that's fine. So the IELTS requirement is for all cohorts. However, if they've done high school in Australia and have achieved their schooling through then we don't necessarily need them to do an IELTS test. I usually recommend it because that way they've got that documentation to prove that they meet that level. Because if we are concerned at any stage that they have come into the degree and aren't up to that standard, then we would ask them to prove that. But yes, and you might like to add, have you got anything else to add there?
Yeah, sorry.
Oh, sorry, did you want to go, Shirley?
Yeah. So if they're Australian school leaver, they automatically meet the entry requirement for most of the health and medical science program. However, if they are applying for nursing, they're still required to have an IELTS 7/7.
Yeah.
Okay.
Great, thank you.
Thanks.
The next question is, if a student wants to apply for a Bachelor's of Psychology and take another specialization in arts, do we have any dual degree or double majors? Maybe for Nicole.
Yeah, absolutely. Yeah, so a student could come into the Bachelor of Psychology and through their electives, they could choose to specialise in some art subjects. So absolutely. And what we recommend is when the students actually come into the Bachelor of Psychology or Psychological Science, they meet with one of our program advisors who will actually be able to select some subjects from the arts faculty that they're interested in and really tailor that specifically to them. So yeah, absolutely.
Thank you, Nicole. Maybe if you can throw some light on the international student quota for medicine, dentistry, and nursing program, Nicole?
Yeah. So for international for nursing, there's about 60 places. And for dentistry and medicine, there's roughly about 35, I think it's 36, 38, round about that. So and that's across all entry pathways, okay, for international.
Excellent. And maybe if you would want to share the places for physiotherapy and occupational therapy as well.
Yeah, sure. So for physiotherapy, we have 57 places, but that's across international and domestic. We don't yet know exactly, like we will break that down further in future years, but for next year being our first year, we're really not sure what the interest will be in those programs internationally. So we're looking at the 57 across both cohorts. As I mentioned earlier, we already have some applications, which is fantastic. So I'm really happy with that. And for occupational therapy, it's 35. And for speech pathology, it's 25. So after the first year, we'll get a better kind of picture of what that looks like. The number of places will rise and we'll be able to break that down a little bit further.
Thanks, Nicole. The next question is, do the students need to apply for registration separately after completing their clinical degrees? It may be all the degrees under health and medical sciences.
Yeah, so each degree will have a registering body, and so the students will they will have already had what we call a student registration, so that allows them to go out on clinical placements. But then once they've completed their degree, so the nurses, for instance, will register with the nursing board, the doctors will register with the medical board. So yes, but we will explain that all to the students and help them with all of that as well as they go along.
The next question is, what is the deadline for MBBS or Bachelor's of Dental Surgery for 2021 intake?
Sorry, the deadline?
Yes.
It depends on, so the deadline for applying is June 30, but the deadline for accepting the offer will depend on a couple of different things. So sometimes your offer may be conditional, and that may be on you meeting such things as the IELTS or the academic score. But within the letter that you actually get, it will give you some very specific dates that you would need to adhere to. But the applications is June 30.
Do we accept international students for Masters of Clinical Psychology?
Yes, we do. Yeah, provided that they have met the entry requirements. Yes, absolutely. We have places for international students.
Do we need a particular background for Masters of Public Health?
No, not necessarily. So a couple of different options. As I mentioned earlier, some students have already got a background in public health and they want to extend their career, maybe going into more senior positions within their sort of current institution. And others, it may be a career change. So they may already have a degree in a different discipline, but they want to change their focus and look at public health. So as long as they meet the entry requirements, then absolutely.
Great. The next question is on the scholarships. Maybe I can take that up one.
Sure.
We're delighted to launch the international scholarship for the University of Adelaide, and we have received an approval from 2021 until the 2025. I request all the attendees to get in touch with the respective regional managers to get an update. There are some exclusions for the health and medical sciences programs, and you would be able to see what programs the scholarships are eligible for under the terms and conditions updated on the university website. The next question for you, Nicole. Maybe we have time for a few more questions. Nish, do you have something to say?
Yeah, I'll just take the next one if you want. The question is, in this situation, students cannot make the necessary documents. How would you suggest we go on this? Look, at this point in time, you need to check with your regional managers as to what the university has put in place. We are accepting digitally certified documents to allow students, but in terms of predicted scores, again, for IB and A levels, yes. For other boards, no at this point in time. As you would know, it's an evolving situation, so it's very hard for us to kind of narrow it down that we will be accepting all 10 items at this point in time. But I would say keep in touch with your regional managers or the relevant teams, and you will have an update as and when the university has made a decision on this.
Thank you, Nish. Maybe for you, Nicole, is there any particular selection criteria for physiotherapy program?
So physiotherapy, it's based on their ATAR score, so their international ATAR or academic score, and the IELTS of 7 as well. And there's some prerequisite subjects, so either chemistry or maths or biology, so one of the three. But there's no UCAT, ANZ or interview required.
Excellent, thank you. For medicine and dental surgery program, is it a must international students to sit for UCAT? And for those students within the travel restrictions during COVID-19, what if they cannot travel outside their country and the test is not available in their home country?
Yeah, sure. So yes, it is a must that they do sit the UCAT ANZ I can share the link with you, but there's some information on the UCAT ANZ website for students who are finding it difficult to either book a test centre or if it's not available in their country. So it will be up to the students to contact the UCAT ANZ company and they will sort that situation out for them. But we can provide the link to that specific piece of information on the website.
Thank you, Nicole. Maybe just to add on what you said, I would strongly recommend if you have any students who are keen for MBBS and dental surgery programs, Today is the deadline, and in most of the countries, there are alternative testing places available. So we strongly recommend you get in touch with the UCAT ANZ office as soon as possible, because the registration deadline is today. Thank you. Do we have any specific entry requirements for Masters of Clinical Nursing?
Yeah, so for the Master of Clinical Nursing, that's for students who already have a degree in another discipline. So say they've got a psychology degree, a 3-year psychology degree, and they want to sort of change focus. So that will be the requirement. They also have to have an IELTS of 7 as well. And yes, graduates will receive registration as a registered nurse. So just think of it as a shortened program for those students who already have studied at bachelor level.
Excellent. Thank you, Nicole. Is it possible for a student to get 1 year of subject credit for the Bachelor's of Nursing program if they've already completed Diploma of Nursing?
So we don't have credit for our clinical degrees. So remember I mentioned the way it's taught is quite integrated. So there's theory and then putting that into practice. So it's very difficult for us to sort of say, well, you can come into that section and you can come into that section and you can come into that section. So everyone has to start at the same time. But I don't think, you know, those degrees are wasted, or the qualifications they did necessarily are wasted, because they certainly give them that background knowledge that will really help them as well. So, yeah.
Excellent. Thank you, Nicole. I think we've covered most of the questions. I would like to, keep track of the time. I thank you to all the attendees for spending an hour of your valuable time with us. And also thanks to all the regional managers for answering other specific regional questions. The webinar is recorded and will be shared along with the PowerPoint presentation by tomorrow. And also, if you have any specific questions, please feel free to get in touch with your respective regional managers. Thank you, everyone, and take care. Bye-bye, and stay safe.
Thanks, everyone. Take care. Bye-bye.
Bye.
Bye-bye. Bye.
Thanks, Nicole.
Thanks, everyone.